Some of the most common head and neck cancers I deal with are skin cancers of the head and neck region, mouth cancers. And commonest of those are things like tongue cancers, cheek lining cancers, neck lumps skin present as a sign of head and neck cancers, and salivary gland cancers are the other common types of head and neck cancers that I deal with. Some of the niche cancers, which are the cancers that affect the eyelids or the eye or the top of the head or the scalp, which then invade to the bone on the skull. So these are not that common but need similar expertise, and these are things I mainly deal with. Most common symptoms that my patients present, patients who've got mouth cancer, can be something very obvious as a lump or an ulcer that fails to settle over a course of a few weeks. It could be more subtle symptoms like discomfort, pain, bleeding, a loose tooth, or a numb area on your lips or your tongue. Common symptoms for patients presenting with skin cancers are again lesions or areas on the skin which fail to settle, bleed, ulcerate, or break down, and some of these patients then go to their GPs, to the dermatologist, or come directly to us. Cancer is a scary word, and this earlier we catch a symptom, the earlier we catch cancer, the better we can provide treatment and the better the outcome is for patients. If you're not sure of something, ask a medical professional to look at it, speak to your doctor, speak to your dentist, and if they have any concerns, you or the doctor himself will pick up the phone and speak to us. The success or failure of cancer treatment depends on the early aspect of diagnosis, assessment, and then leading on to management. The advantage of seeing a doctor early is that we can then see you, take a detailed history, examine you, and then organize the correct diagnostic aids, which might be taking a small piece of the sample, which is tested for scans, which involve scans such as MRI or CT scans, and then this gives us enough information to organize a treatment. Ideally, we would aim to try and organize these within a time frame, which would be the first couple of weeks, so we can decide on treatment, what is needed, and organize treatment. The earlier we can diagnose these things, we can get the scans done, and then that leads us to treat cancers efficiently and effectively. The typical patient pathway for a patient coming to see me would be either a direct referral by the patient or through their GPs or through their dentists. When you come to see me, you will have full attention. I will ask you questions about your medical history, about what's been happening. I will then thoroughly examine you and then, if needed, organize the relevant investigations. Depending on the outcome of these investigations, then we can decide what is needed and how we treat the problem. When my patients come and see me here, I think it is the communication with the patient, spending time listening to them, diagnosis, and a timely effort within days to get all the investigations done and make a treatment plan is reassuring. What is most disconcerting for patients and their family is not being able to access healthcare in a timely fashion, or the fear of the unknown, which is what we try and avoid. Good communication and keeping the patient guided throughout the journey before, during, and after surgery is what we're looking for.